There is no need to avoid places that have linked to confirmed and suspected cases of the virus. The clinical director of the National Centre for Infectious Diseases has debunked such advice that's been circulating online. Dr. Shawn Vasoo spoke to CNA about how the virus is transmitted and the actual risks it poses to the public. Isabel Lim with more.
Getting the infection from merely walking through places is untrue, so categorically untrue. You don't get infection typically from places, but from infected persons. So I would say that the messages which have been going out on WhatsApp and other social media, we should not be spreading them because it causes an unnecessary degree of paranoia and worry amongst people. You only get infected by, typically by an infected person, and you have to be in quite close contact with the person.
So you mentioned close contact is one of the ways in which you can be infected by the coronavirus. Yeah. But how close is close, and what's the probability of getting infected with close contact?
When we say close contact, typically we refer to people who are living in the same household, who are caring for someone who might be infected, who share the same space for a prolonged period of time. Now, transient contact, for example, walking past someone transiently in a public space, is not considered close contact, and the likelihood for infection for that is probably minuscule.
How long does the virus stay alive outside of the human body?
I think it's quite safe to assume the new coronavirus behaves like the other coronavirus we know about. Typically, these viruses and respiratory droplets, if they are on a surface, survive for a few hours. And this is because in our hot and humid environment, their survival is actually shorter, unlike colder climates.
Are there groups, the young, the very, very old, perhaps pregnant women who are particularly vulnerable to this new coronavirus?
In terms of people who are vulnerable, I typically would consider those who are elderly, the young, and those who have chronic diseases or other reasons for impaired immune system. Interestingly, in this outbreak, actually, we have seen few children who have been infected and they have not seen severe disease. Those who have had more serious forms of disease, for example, pneumonia in this outbreak, and the percent rate is actually not as high as SARS in 2003.
What is recovery from this virus like?
Most of the people in this outbreak have actually had a very mild form of disease, similar to the other common respiratory viruses like common cold and also influenza. So they have recovered actually by themselves without any specific treatment, and really it's the body's own immune system overcoming the infection. There's a small percentage who develop more serious illness, and those have recovered with just supportive medical care.